Dr. Matthew Crooks here. Recently I had the honor of treating 6-time Olympic gold medalist Amy Van Dyken and helping her manage her low back and leg pain. We used a procedure called Radio Frequency Ablation, in which we use heat energy applied through a minimally invasive cannula under X-ray guidance. There's no incision for this procedure. It deadens the little sensory nerves in the back that sense pain in the joints. Let me walk you through the procedure and explain how it's done. So we start by doing a sterile prep on the back. You can see there's an X-ray camera called a fluoroscope above the patient. We have the option of doing a little bit of sedation for the procedure. Most people for this type of procedure take some light sedation so that they're nice and comfortable for the procedure. Interestingly, for this type of procedure, it's classically for pain that's right along the spine or in the low back, and it really treats that primarily, but a secondary effect can be to treat nerve pain or denervation pain in the legs, so it can secondarily help with the sort of phantom pains that you'll get with a phantom limb syndrome with an amputation, or with neuropathic pain in the lower extremities of someone who's been paralyzed, which is the case of Amy. And so we've seen over the years in treating people's back pain that they'll also get pain relief from the really severe pain in the legs that is essentially untreated by any other modality, but by ablating the little sensory nerves in the back, that sends a signal to the nerves in the legs to calm those down as well. And so patients like her will get 6 months of relief of this unremitting leg pain in a paralyzed limb. So here under X-ray, we're taking a look at the screen on the X-ray. We're placing needles right down below the skin. You can see they're very small needles, right down to the joints in the back and the lumbar spine, one after another. And you can see that I'm looking at the X-ray that's behind the camera here. And she's under really light sedation, so breathing on her own. We have an anesthetist there watching over her as well. And we're doing 4 needles, so 4 levels on each side. So we have the needles placed already through the sterile skin there. And I'm just tapping on those needles to see by feel, in addition to watching them on X-ray, to feel that they're right in the right spot. So that goes back to sort of the anesthesiology training where I'm used to doing labor and delivery epidurals for pregnant women that you can't use an X-ray on. So that's one advantage of having an anesthesia background, is you can pretty much do a lot of these injections by feel only without having to rely only on the images. So we've already got 4 of the needles in right to the right spot, and we confirm that both by feel and on the X-ray. And so here my assistant is helping me attach the cannula to the needle, and then we send a little electrical impulse through the needle that causes the muscle in the back to twitch, that helps to confirm that we're in the right spot. Once we can see that we're in the right spot, we inject some local anesthetic in through each one of the needles to numb up the nerves. We numb these nerves up so to minimize discomfort when we're sending a little heat impulse to them to ablate them. So they're numbed up just like you'd go to the dentist office and they numb you up for dental work. We inject some local anesthetic here and then place the other ablation cannulas in through the needles. You can see that she also does cupping. She has the circular cupping signs on her back here from cupping rehabilitation. And it's another sign that no single modality is perfect. And so you look to use this in addition to rehabilitation. So you're treating kind of different areas. This is treating right in the underlying spot that's generating the pain, but then superficial areas like muscles, you can get great relief with physical therapy modalities like cupping. So we've got all 4 cannulas in on the one side, just confirming that the needles are still in the right spot. And this is such a elegant procedure, that has to be very precise because there's no incision. We can't directly visualize things, so we need to make sure that we have the exact right spot where this tiny little nerve sits. And I think that's where experience and training come into play, because there are a lot of practices that do this procedure without the underlying fundamental knowledge and experience to get things just exactly perfect and place the thread through the eye of the needle, so to speak. We have, you could see when we had a shot of the screen that she's had a lumbar fusion that was part of her accident that stabilized her spine. So we're working around the bars of the lumbar fusion also. Now, while we have one side ablating, we start on the other side. The radio frequency ablation heats the needles to 80 degrees Celsius for 90 seconds. So that's all that it takes once you're in the right spot. So it doesn't take that much heat or that much length of time as long as you have things right to the perfect spot. So now we're working on the other side. So when done precisely and perfectly with someone that has the proper training and experience, this procedure really should not take more than 10 minutes. We, on more difficult and challenging cases, will take as much time as needed, but there are places that take 30 to 45 minutes to obtain an inferior result. So again, we're placing the cannula down right to that spot here, and so I still remember the first radio frequency ablation that I saw, which was in residency at Johns Hopkins, and it was the pain management fellow, Dr. Chad Brummett, who's now the director of pain management at University of Michigan, and he walked me through this for the first time when I saw it. And so shout out to my mentors at Johns Hopkins, because they give me top level training for sure as a resident before even doing a pain management fellowship. This is a lot of radio frequency ablations between then and now, that's for sure. Once we get those spots placed, we'll take the needles out on the other side and start the ablation on the right side. Again, confirming the spots, making sure that the needles haven't moved, because it's really even a millimeter of movement one way or the other. It's not necessarily dangerous, but it can miss the small sensory nerve that you're trying to ablate and give you an inferior result. And we're taking out the needles from the first side here. So yeah, interestingly, this is it's a technique for her that, while it does help with her back pain, it really helps with this nerve pain in the lower part of the body that's below her injury and below her spinal cord injury, where you don't have normal sensory function, you don't have normal motor function, but you still have this nerve pain that can be unremitting, and there are very few treatment options for it. It just so happens that this is a secondary effect of the ablation for the back that not all that many pain physicians even know about. Again, confirming on the x-ray, making sure that nothing is moved. She's really comfortable here. And you could see even during this ablation, with a little light sedation like this, no discomfort whatsoever. And once we're finished, she pretty much was waking up a couple of minutes after the procedure. Take out the heat cannulas here, the ablation cannulas, and give a little more local anesthetic there just to numb it up so she's not uncomfortable after the procedure. There could be some soreness there in the spot of the ablation for a few days or even up to a week or so at a time. You can see there's no incision there. That's just little needle pokes that we're dabbing with blood. Once we dab that with a little gauze, we put a bandage on there that goes off before the day is over. That's it. Dr. Matthew Crooks here. I hope you've enjoyed this inside look at one of the pain management procedures that we perform here at Pinnacle Pain and Spine. We'd love to do a consultation with you if you have low back or neck pain. We don't only treat Olympic athletes. These are minimally invasive procedures that are covered by most insurances, and we look forward to seeing you in the office soon.